Did you know? Just one hospital stay in the US can cost a senior as much as a small house, and the frightening truth is, even with insurance, the bill can still be big enough to shake a family's finances. Illness, it's not only the fear of the elderly, but also a burden carried by their children and grandchildren, generation after generation. Illness, a fear that knows no borders. In every country, old age is tied to rising health risks. Some studies suggest that rates of chronic diseases such as heart disease, diabetes, arthritis, and cancer climb sharply after age 60. Not only in the US, but in Canada, Europe, and Australia, older adults face the same haunting fear: declining health and escalating treatment costs. Some experts argue that illness in old age is not just a medical issue but a social one, because every time parents or grandparents fall sick, the whole family, children and grandchildren, shoulders the responsibility of care, financial strain, and emotional stress. Healthcare costs in the US. The nightmare of old age in the US, healthcare costs are notoriously high. Several reports indicate that a single heart attack treatment can exceed $100,000. A knee replacement surgery costs between $35,000, $60,000. One day in the ICU can range from $3,000, $10,000. These figures are staggering, and even more worrying. Even with insurance, the out-of-pocket expenses can still weigh heavily on seniors and their families. Some experts say the U.S. health insurance system is complex and often fails to meet patients' needs in time. Some insured patients still wait months for surgery. Others have coverage for part of their care but must pay large sums for medications, rehabilitation, or follow-up treatment. Beyond America, a shared fear across developed nations. In Canada and Europe, where public healthcare systems exist, research notes frequent long waiting times for major surgeries. In Australia, out-of-pocket costs can still be high, and many seniors must pay extra for timely or better quality services. This shows that regardless of the healthcare model, seniors share the same fear: worldwide cost, delay, and uncertainty when illness strikes. The burden across generations. Experts point out that illness is not only a personal burden for seniors, but also a strain on their families. When grandparents are hospitalized, children may have to take time off work to provide care or borrow money to cover bills. Many families fall into financial hardship, not from lack of love, but because of crushing medical costs. Stories abound of seniors who, after a single fall and hip fracture, left their families drowning in debt from surgery and rehabilitation costs. Illness in old age is not just an individual matter, it's a multi-generational burden. The price of delay. Some studies show that even insured patients avoid doctor visits for fear of additional expenses. This often leads to late diagnoses, making treatment more expensive and outcomes worse. It's a vicious cycle. Delay leads to higher costs, make patients hesitate further. Experts describe this as one of the paradoxes of modern healthcare. Insurance and doctors exist, yet patients still fail to get timely treatment. Illness can take away health, money, and even the joy of old age. But here's the good news: we are not powerless. Many studies suggest that with the right lifestyle, smart use of insurance, and new healthcare innovations, seniors can live healthier, reduce financial burdens, and truly enjoy their golden years. Prevention is better than cure. The key to lower costs. Some experts estimate that up to 80% of age-related diseases can be prevented or controlled with healthier habits. Nutrition, diets rich in vegetables, whole grains, and omega-3 fish reduce the risk of heart disease. Some research shows the Mediterranean diet can lower heart disease risk by 30%. Exercise. Just 30 minutes of walking daily reduces risks of diabetes, high blood pressure, and depression. Sleep. Quality sleep helps prevent memory decline and restores the body. Mental health. Joining clubs, volunteering, or learning a new skill keeps the brain active and lowers dementia risk. The cost of prevention is much lower than treatment. For example, diabetes medications can cost $500, $1,000 per month, but healthy living can delay or even prevent the disease. The crucial role of health insurance. Many older adults worry. Even with insurance, healthcare is expensive. True, but without insurance, the risk is catastrophic. In the U.S., Medicare covers most hospital and medical costs for those 65 plus, though gaps remain out-of-pocket expenses. Many purchase Medigap or Medicare Advantage to cover those gaps. Experts suggest viewing insurance not as a burden but as a financial shield. When a major illness strikes, it prevents families from going bankrupt. In Canada, Europe, and Australia, public systems cover much, but wait times can be long. Many buy private insurance for quicker access. Message: no insurance equals extreme financial risk. Premiums may feel costly, but still far less than one uninsured hospital stay. New healthcare trends for seniors. Healthcare is rapidly evolving, offering seniors more tools to stay healthy and reduce costs. Video consultations replace long hospital visits, saves time, travel costs, and provides continuity of care. Vital for rural seniors or those with chronic conditions. Home health devices, smartwatches, tracking heart rate, blood pressure, sleep, non-invasive glucose monitors. Early alerts prevent emergencies and unnecessary hospital stays. Community care models. In Europe, seniors stay at home but receive regular nurse visits, reduces hospital dependency while maintaining quality of life. Artificial intelligence AI analyzes medical history, predicts risks, and supports personalized care, reduces errors, optimizes costs, and empowers both doctors and patients. Lessons from around the world. Some experts argue the U.S. spends more, partly because of fragmented systems. By contrast, Germany, dual public-private insurance allows flexibility and competition. Sweden, heavy government investment in prevention, exercise, healthy diets, and senior wellness programs. Japan, strong cultural nutrition and community-based care lead to lower rates of chronic disease. Lesson. Better health outcomes depend not only on medicine but also on policies and habits. Family, the first line of insurance beyond formal insurance. Family remains the most immediate safety net. Studies show seniors living near their children and grandchildren have lower rates of depression and even live longer. Families help with online appointments, medication management, and financial support. Seniors, in turn, contribute wisdom, emotional support, and childcare. Illness in old age is therefore not just a healthcare issue, it's a family issue. Preparing for the future, experts recommend preparing before old age, ideally in the 40s and 50s. Purchase adequate health insurance early. Build health savings accounts. Adopt preventive lifestyles now to reduce risks later. Early preparation lightens the future burden for both seniors and their families. Illness in old age is a global fear, but not an inevitable fate. Solutions lie in prevention, smart insurance, technology, and family bonds. But one question remains. Once illness occurs, how can seniors not only survive but live with quality? Are there holistic care models around the world that ensure dignity, meaning, and joy in later life? Stay tuned for Part 3, where we'll explore how to transform old age into true golden years, not just free of disease, but filled with purpose and happiness. If this matters to you, don't forget to like, subscribe, share to spread the message. Aging is not a burden, it's an opportunity if we prepare wisely.